I am Dr. Shravan Bohra. I am working as a chief gastroenterologist and liver disease specialist at Apollo Hospitals, Ahmedabad, in India. We run busy gastroenterology and liver disease services at Apollo Hospitals, Ahmedabad. And recently we have also initiated a liver transplant program at this hospital. I am going to talk about hepatitis B and C, the two viruses which are known to cause very serious damage to the liver. These viruses are known to cause acute as well as chronic liver disease. Acute liver disease means it is of short duration and generally resolves within 6 months. Chronic liver disease would last for more than 6 months. Both these viruses, if the disease is unrecognized and untreated, can eventually cause chronic liver disease, what you call as cirrhosis of liver. And if it goes even further, some of them can develop hepatocellular carcinoma, which is a potentially serious disease. That is the reason it is important to protect ourselves and the society against these two killer viruses, because they are known to cause a very silent liver disease. You may have this question in your mind: where did you get these two deadly infections from? The common sources for acquiring hepatitis B and C, many of the sources are more or less the same, but few sources are peculiar to the either viruses. Hepatitis B and C are transmitted by contaminated blood and blood products. So if the blood and blood products are not screened properly, one can get hepatitis B or C. Another source of transmission would be, reusable needles, syringes and multi-dose vials, which are still used in many countries, unfortunately, and that could lead to transmission of hepatitis B and C viruses from one person to another person. Hepatitis B also has a sexual route of transmission, and it can be transmitted sexually, and this is a fairly common route of transmission. Hepatitis B particularly can spread from one spouse to another spouse, and hepatitis B is also known to spread from mother to a baby, and that is a very, very serious situation to arise for a newborn baby. Hepatitis C particularly is transmitted from use of blood and blood products which are not properly screened. Dialysis is yet another route of transmission for hepatitis C. So those chronic kidney disease patients who are on regular dialysis, they can acquire hepatitis C. Then use of intravenous drugs, or what you call it intravenous drug abuse, is yet another route of transmission for hepatitis B and C. Tattoo making is a common practice nowadays, and tattoo making, if the needles are reused or if the needles are used for a number of patients at a time, then one can get hepatitis B and C. So these are some of the common route of transmission for the two viruses. Now you may have this question in mind: how one can get to know whether you have got these viruses in your body or not. Now when these viruses enter somebody's body, in majority of the cases they cause an acute illness, what you call as acute hepatitis, where a person can have symptoms like loss of appetite, nausea, vomiting, and some mild upper abdominal pain. Now these symptoms may last for a week or two, or maybe up to a couple of months, but generally they resolve, and then the person may completely forget the illness. So this is typical of acute hepatitis B and C. Very rarely acute hepatitis B can cause acute liver failure, which can be life-threatening. But what is more peculiar about these two viruses is that after an acute illness, about 5 to 10% of adults with hepatitis B will develop a chronic liver disease leading to chronic hepatitis and even cirrhosis of liver. With hepatitis C, about 2/3 of the patients who develop acute hepatitis C would develop chronic hepatitis C, chronic liver disease, and then some of them will develop cirrhosis of liver, and few may develop hepatocellular carcinoma. There is a long lag period between acute hepatitis and development of cirrhosis. This period is anywhere from 10 to 25 years for hepatitis B, and this is anywhere from 20 to 35 years for hepatitis C. But once you have cirrhosis, it is a potentially, chronic, debilitating, crippling disease, and eventually many of them will die because of chronic liver disease. So if you need to know whether you've got these viruses in your body, it is important to get your blood profile, particularly your liver blood testing, and then a sonography of the liver. For detection of hepatitis B, a test is available, what you call as HBsAg. This is an antigen against hepatitis B virus, HBsAg. And for hepatitis C, there is a test available called as hepatitis C antibody test. So these tests, if done, and if they are positive, that would indicate that one is suffering from these viruses. And once these tests are positive, we do advise some more investigations to evaluate if a person has got minor problem or it is a serious life-threatening condition. And by doing these tests, one can find out if somebody is carrying these viruses. Now it is important to know, because if these viruses are detected at an early stage, then a person can be treated and all the complications can be prevented to a great extent. Yet another thing which is important to know about these viruses is that once you know that you have got these viruses, what else should you do? So once somebody knows that you have got these viruses, it is important to take some necessary steps, because if somebody is positive for hepatitis B, he can spread the infection to his spouse and occasionally to some of the family members. So all the family members and a spouse should first of all screen for hepatitis B by doing this HBsAg investigation, and then these family members and spouse should be vaccinated against hepatitis B so that they may not acquire this deadly virus from one person to another person. And then once you know that you are hepatitis B positive, you need to get further investigation to find out if you have already developed cirrhosis of liver or if you have already developed hepatocellular carcinoma. If somebody has not yet developed chronic hepatitis leading to cirrhosis of liver, then this person can be treated with antiviral drugs which are pretty effective. For hepatitis C, generally spouse-to-spouse transmission is very rare. It is say less than 3%. But still, if one spouse is found positive, it's a good idea to have another spouse checked out for hepatitis C virus. When intravenous drug abusers are infected by these intravenous needles, other persons who may have been sharing the needles should also be screened. Those patients who are on hemodialysis, their blood should also be screened on the regular basis to find out in case they have acquired this virus. Hepatitis B and C, once they are detected, then we evaluate them and we decide whether for hepatitis B a person qualifies for treatment. So as I said earlier, that only about 5 to 10% patients who develop hepatitis B would develop chronic liver disease. So these are the only patients who will require treatment. So we try to identify those patients by doing a special test, what we call as HBV DNA. So this is a DNA estimation of this hepatitis B virus. And then we also look for another special test called as hepatitis E antigen. And then we do a sonography and if necessary a CT scan of the liver and occasionally a biopsy of the liver to find out if the person has already developed serious damage to the liver. And then after doing all these investigations, we plan a treatment for these patients. Similarly for hepatitis C, we do a special investigation, what we call as HCV RNA. So that will tell what is the viral load of hepatitis C virus in an individual patient, because in 2% of the patients you can have false positive HCV antibody test. So that's the value of doing HCV RNA investigation. And then we also do a special investigation to find out what genotype this patient is suffering from, because the prognosis of the disease depends upon a individual genotype. Just for example, genotype 1 has a much serious liver disease and much worse consequences as compared to genotype 3. And then in B and C, if they have chronic liver disease, we also do a special test, what we call as alpha fetoprotein, to find out if a person has developed hepatocellular carcinoma. This is a basic screening investigation along with other investigations to identify if a person has developed hepatocellular carcinoma. Now, those patients who are found to have active chronic hepatitis B, two groups of drugs are available to treat them. There is a parenteral drug called as pegylated interferon, and then we have got a number of oral drugs called as tenofovir, entecavir, lamivudine, adifovir, talbivudine, and so on. So this is decided on case-to-case basis which patient should go on oral medication and which patient should be treated by parenteral interferon therapy. Interferon therapy has the advantage that the treatment is generally going to go for 48 weeks, and after that we stop the treatment. So that is good about interferon. But the problem is interferon treatment is effective in only about 30 to 35% of the cases. And interferon is a much costly treatment as compared to oral antiviral drugs that I've just mentioned. Oral antiviral drugs are very effective, they are very safe, very little side effects. But unfortunately, the problem that we have now encountered with the oral antiviral drugs is a issue of drug resistance. Like lamivudine has been very popular drug for hepatitis B, but now we know that there is a very high incidence of drug resistance with lamivudine, and we hardly use this drug. But newer drugs like tenofovir and entecavir, they are very effective. The person will have undetectable viral load after about 12 months of treatment, and then after 2 years on case-to-case basis we decide if it is possible to stop the treatment. But what we have learned over a period of years, that those patients who are E antigen negative, it is really difficult to stop the treatment, because if you stop the treatment there is a risk of relapse of viremia, and that can be again difficult to treat. Regarding hepatitis C, the cornerstone of treatment available in my country is a combination of ribavirin along with the pegylated interferon. These two drugs are available and they are quite effective for genotype 3, which is very common in India. This is good about it. But for genotype 1, a combination of ribavirin and pegylated interferon is not quite effective, and the success rate is less than 55%. So once we decide that a person has got high viral load, active hepatitis C, then we decide to treat these patients with the combination of these two drugs are available. But again, cost is an issue, because this treatment goes for 24 to 48 weeks, and of course interferon is a costly drug. And as I said, genotype 1 patients are difficult to treat because there is a risk of relapse after stopping the treatment. And those patients with hepatitis C who have already developed cirrhosis of liver, these are the patients who are again difficult to treat. In these patients, 24 weeks treatment is generally not effective, and they all require about 48 weeks of treatment, and even after that the success of treatment is limited. So what I want to really share with you today is that these two viruses can remain completely silent in your body. You may have no symptom whatsoever. But if you fall into the high risk category, like if you have received any blood products, if you have been an intravenous drug abuser, if you have ever been dialyzed even on one occasion, if you have undergone multiple surgical or multiple dental procedures, if you have a high risk sexual behavior, and if any of your family members are positive for hepatitis B, then yes, you do run a risk, and it is worth getting yourself checked for these two viruses in case you are positive. Because if your disease is detected at an early stage, it can be treated successfully with a treatment, and you can have a good quality of life. If these viruses, if your disease is detected at a very late stage, means you already developed cirrhosis or hepatocellular carcinoma, then survival is very short, quality of life is very poor, and it is a very, very difficult situation for the family members, because majority of these patients are in and out of the hospital. It's a good news that vaccination is widely available for hepatitis B virus, but unfortunately still it is not being offered to every individual for whatever reasons. I strongly feel that all mothers should be screened for hepatitis B viruses when they become pregnant, and all high risk patients should be screened for hepatitis B. All healthcare workers must have vaccination for hepatitis B, and all children should be vaccinated for hepatitis B, because now we know that hepatitis B vaccine is very effective. It has got more than 95% success rate. It is fairly cheap, easily available, practically no side effects of this hepatitis B vaccination, and once you get 3 doses at the interval of 0, 1 and 6 months, you are fairly well protected against this hepatitis B virus. So yes, one should go for this vaccination against hepatitis B. For hepatitis C, unfortunately, vaccination is not yet available, so prevention is always better than cure. If you are offered a blood product, one should make sure that blood products are used very judiciously. They are screened as per the international protocols. Intravenous drug abuse is condemned, and if somebody has say a mother is found to be positive for hepatitis C virus, then the baby should also be screened. If a husband is found positive for hepatitis C virus, wife should be screened, so that you get to know whether they are also positive. That's all I have to share with you. Thank you very much. It was really nice talking.